Payers have long understood the notion of individualized therapy, but they haven't thought about it as much in the context of administering their health plans. It's clear from our research that they have good understanding of population-based management approaches, but drilling it down to the patient level becomes a little bit more challenging because many times they don't have that information at which they could apply those benefits at a patient level situation. So therefore, having that information, especially on subgroups, patients that were going to respond to therapy or not respond to therapy, becomes really important for them, but many times they're operating in a data vacuum. Informing pharmacy and medical directors about the issue of heterogeneity and individualized treatment effects is important because then it allows them to tailor their approaches to managing the drug and pharmacy benefit. Historically, they've done it at a fairly population-based level. And now we've given them some tools to start to think about how might they change their benefit design such that they can maximize the value with individual therapies towards specific patients. The key issue here is getting information from the patients to the providers and the providers to the payers. Clinicians are trained to think of the exception. However, over time, many of these clinicians, especially pharmacists in particular, have focused primarily on the population level, ignoring the patient level differences. And part of that is due to the fact that when we've promoted products or discovered or evaluated products in a general context, we tend to focus too much on the mean and not necessarily the variance around that. So I think as the FDA starts to incorporate more measures of variance in their package labeling, and as we become a little bit more sophisticated in our educational approach, discussing both the mean and the variance, that individualized treatment effects will become much more useful to clinicians, especially those at the population management level.